The Honourable Member for Brandon Souris.
Thank you, Madam Speaker. And just in relation to the question that my colleague from Cumberland Colchester asked the Minister of Health, I have a letter here from a local dentist in my area, and I'm just wondering if he could refer to any similarities between the Canadian Dental Care Plan and what is being rolled out in the Pharmacare Plan. This dentist says that it may place our oral dental care system in serious jeopardy. Goes on to say that it's deeply flawed and stands to jeopardize our entire established system and how we deliver care to our patients. And says that only 70% of the dentists have said they are likely to participate as a provider in the CDCP program. It goes on to say that patients are going to be surprised to learn that dental care will not be free. They may not be able to choose their preferred dentist, and nothing has been done to protect access to third-party insurance. So I just want to ask my colleague from Cumberland Colchester if he can outline further than he did in his speech, which was a great speech, by the way, any similarities that he can see between this plan and the Pharmacare Plan.
Member for Cumberland Colchester.
Well, Madam Speaker, thank you very much. I thank my colleague from Brandon Souris for his insightful question. We know that this NDP-Liberal coalition wants to create federated programs that are going to reduce the choice for Canadians and push those that do have access to their beloved care that they now have into a program that will cover much less medications. For instance, we know at the current time that public programs cover about half of the medications that privately funded plans do. So that will reduce choice for Canadians. What incentive will there be for employers to continue to provide plans for their hardworking employees in the future if a federated plan with a few old medications on it is what is being offered, quote unquote, for free on the backs of all Canadians, which of course we know that does not count for the bloated bureaucracy that it will take. As I mentioned, creating a new Canada Drug Agency in and of itself, at least $90 million just to create it. And even though my great colleague suggested that perhaps 70% of dentists may support it, we know from the figures now that only less than 10% of the 26,500 dentists in Canada have signed up for this program, which is severely limiting access for Canadians. Indeed, last week, in one day, 4 great supporters from Cumberland Colchester showed up in my office and said, I have this shiny card for the dental care program. I cannot find a dentist to actually provide the care because of the terrible nature of this program that has been created without consultation of the great dentists who provide care to millions of Canadians across this country. It's a shame. They should be ashamed of their program, and they should be ashamed of the fact that they want to introduce another bloated, federated program on the backs of hardworking Canadians.